Good afternoon, all Facebook friends. Very good afternoon. I'm Dr. Arvind Sharma, Senior Neurologist and Stroke Specialist at Zydus Hospital. I welcome you all on this stroke awareness program on brain attack, and especially in a month when there is a World Stroke Day coming up on 29th October. So we would like to spread the awareness about the stroke. And I would definitely like who are viewing this program would ask question, and it will be more and more interactive. It will be great. So before we go to stroke, what is stroke? We'll go in a definite 4 or 5 areas which everyone want to know. What is stroke? What are the symptoms of stroke? How we can prevent it? What are the treatment and the management of stroke? And if you have suffered a stroke, how you can recover from it. And if you have suffered a stroke, how you cannot have the another stroke. So first of all, stroke is a brain attack. It's not in the heart. It's a myth among the people that stroke is affecting the heart. It affects the brain. That is known as brain attack. So how it happens? Generally in the heart attack, only the blood vessel is occluded. But in the brain attack, if you see, there is a disruption of the blood supply to that particular part of the brain. And if I show you on this, if you can view on this, there is an occlusion of the artery here, and there is a rupture of the vessel here. So there are 2 types of stroke. The maximum percentage of stroke, which are of the clot, where the blood is not reaching to the brain, is known as ischemic stroke, where there is a clot. They are 85%. And the another type of the stroke, where there is a rupture of vessel, there is a artery which is ruptured because of the high blood pressure or because of the thinning, which is known as aneurysm. Those are known as hemorrhagic stroke, which are 15%. So we'll more here talk about the ischemic strokes. Ischemic strokes are those where there is a occlusion of vessels. And how you know that the person has suffered a stroke? What are the symptoms of the stroke? So the symptoms of the stroke are like sudden onset. The sudden word, which is in Hindi known as achanak. The sudden onset, there is a weakness of one arm and one leg. There is difficulty in speech, not able to convey what they want to say. There is a language problem. Or they are not able to use their hand and leg. There is a numbness and tingling. There is balance problem. They are not able to walk. That is known as vertigo. There is vision suddenly affected, and they feel revolving of the surrounding, which is known as vertigo. So these all the symptoms, when they occur sudden, they are the symptom of stroke. I'll give you one example of a stroke where how people misinterpret and think that there is something else. There is one gentleman who was 36-year-old, who's a CEO of one of the company, suffered suddenly difficulty in the speech. He was not able to convey what he wanted to say. If you ask him, what is your name? He would used to say, I'm living in Prahlad Nagar, or I'm living near Zydus, but he was not able to communicate what is his name. He was having a language problem at that time. He went to 2 psychiatrists before visiting to our hospital, and he was given the treatment for that, as he's a CEO and he's young and he's a lot of pressure. So he was treated because he's mentally upset. So he was given a sleep medication, and 2 days he took that treatment. Then he came to the ER to see another psychiatrist that he's suffering this kind of problem where he's not able to communicate what he wants to say. So as the team, we were there our team was there to see another patient. And when he told this complaint to the ER resident at the time, we asked about the detail. So what he was suffering was a language problem, where he was not able to communicate what he was asked, like what is his name, what job he does. He was not able to communicate. That is, in our language, it is known as, medical language, it is known as aphasia. And it occurs because there is a clot in the parietal region where the area is dead. So that is why the patient suffered aphasia, and he was not able to communicate, and it turned out to be a stroke. and there was some heart problem. We identified it, and subsequently he was treated. Now, he was treated with blood thinners, I agree, but the job of the stroke neurologist is not finished here. How he will go to the job, that was the question, because when somebody asked him a question, he was not able to answer in his office. Now the job comes of the speech therapy that is known as stroke. Also, so we have sent him to the speech therapist. He gone to the speech therapist for 3 months, joined as a CEO again, and he went subsequently to the pilgrimage and came back and thanked that he developed that confidence. So only to treat stroke is not a job. To give him again the ergonomics, the quality of life, what he was suffering is important, like the arm and leg weakness. Not to reverse the clot, to reverse the paralysis is the ultimate aim. We will discuss about it in further. But once a person suffers and not able to reach the hospital on time, there are subsequent stroke rehabilitation like physiotherapy, which are also very important. That we will discuss subsequently. So first we discussed about what is stroke. We discussed about the symptoms. Now we'll come about how you can prevent it. Then we'll discuss how we can treat it. Now, those who doesn't have the stroke, but they have the family history, they see people at a young age and suffer a stroke. You have heard many stories. A young gentleman, a very good in speech, a good orator, was standing and giving the talk. You have many examples on YouTube, and suddenly suffered a stroke. There was a slurred speech, and and 1 lakh weak. So it is not like this that you are in a party or you are in a good mood, you cannot suffer a stroke. It is not like this. So how to prevent it? So they are all same like cardiac. Brain is also vascular. You are supplying blood against the gravity to the brain. These are the 2 anterior vessels, and there are the 2 posterior vessels which are supplying to the brain. So if any of these vessels are occluded, you can suffer a stroke. So same like heart has 3 arteries, they are occluded. So for the heart, they are the risk factor for the brain. Like if you do a regular exercise, it's a preaching, it applies to me also. I should also walk 5 times in a day, 3 to 4 kilometers. Then second, you have to keep your blood pressure, your diabetes, and other factors in control like lipids. But the most important, very important in the lifestyle, don't smoke. Smoking is one of the very great risk factor. Those who are a smoker for 5 years, so don't smoke. So these are the risk factors which you have to control, and you have to take vegetables, but you have not to be very ideal in everything. You have to spoil yourself sometimes, but always the very good and very bad at the extreme is not good. So you have to be in the middle. So it's not like that those who run marathon, they always remain good. It is not like this. It's a brisk walk, 3 to 4 kilometers, which is important. It is not that you will run marathon, you will not have any disease on this earth. It is not. So balancing in life is very important. Many times, many people come and they ask the question, is stress caused? So that stress word, when they ask, is very important, right? So stress doesn't precipitate stroke. It precipitates a body condition, right? It can affect any organ. Stress. If you take a stress here, and what is stress, right? If you take a stress, means you are having a stress at home or at workplace. Now you know how the workplace are. They are from morning 8 to till late evening for everyone, and they are worked up with their frontal lobe with all the information. They don't relax in their working environment. So the stress, if you keep it here and don't drop it, then you are affecting every part of your body, not only brain, it's heart, kidney, whatever organ you talk in your body. And if you take your stress still here, it will precipitate all kind of disease. So you have to drop the condition at that time and lose yourself on that particular stressful situation. So it applies for all of us. So these, what we have talked about the risk factors. Now we come to the further points, how we can get the treatment of stroke and what are the stroke ready centers when we discussed in our Indian Stroke Association or World Stroke Organization. What are stroke ready centers? Those who are treating the patient having a CT scan in their hospital. Our CT scan is equivalent to ECG of the cardiac. So we have to know that there is a clot or there is a hemorrhage in the brain, because treatment is set apart for both the conditions. So stroke ready centers are those where there is a CT scan and MRI. CT is a primary requisite where you can identify there is a clot and there is a golden period. There is a golden. If you suffer acute stroke within 4.5 hours and you reach the hospital, you can treat such patients within time that is known as the golden period for acute stroke. So when you reach to such centers, you have undergone, like you go ECG, you go undergo a CT scan, and when you find to have a clot, you are treated with a clot buster drug, which is known as altiplase. It dissolves the clot and your paralysis can be reversed. And those who are stroke ready centers, they are doing very uniformly across the city, and every hospital has a set protocol. Like our protocol is triage and the ER system. Patient comes and goes straight to the priority one area where the acute stroke are given the priority for the patient for the CT scan also. We do a CT scan and we thrombolize with that clot buster drug within 4.5 hours. And we start the drug and we give the bolus and do the treatment. Those who are more than 4.5 hours, we have a facility of stroke intervention, and those who are stroke ready centers, they have a facility of stroke intervention in the form of they can take out the clot while taking the patient to the cath lab and doing an angio and take out the clot. That is known as mechanical thrombectomy. And now, as the later sisters is coming, that you can do up to 9 hours, and for the small brain, you can even go up to the 24 hours. So you should not get disheartened that you are 4 hours or 3 hours. As soon as you suffer a stroke, you should rush to the hospital by calling 10, as we say in Gujarat. That is the emergency number. You should straight go to the hospital who are stroke ready centers. So that is the point for the acute treatment. Very high volume centers with treating acute stroke, but they are not able to treat more than 20% of the patient with acute stroke within the window. So what about those 80% of patients? They are also eligible for the treatment, right? So they are not for that golden period of 4.5 hours for IV and 9 hours for intra-arterial or mechanical thrombectomy, but they are patients for further recovery and treatment of their paralysis. So they should also not wait as you become more and more old stroke. If you don't get the treatment early, you are deformity on the road, their hand is lying straight to their chest and the limb. So what are our aim? If the patient reach in the golden period, we reverse the paralysis as a stroke neurologist. But those who are not able to reach on time, they also deserve a treatment that they doesn't develop the deformity or disability. So there are many things which we can do for them. We can find out what is the mechanism of stroke. So is it critical occlusion in the neck, what is supplying to the brain, and the rehabilitation? That is the physiotherapy. Arm and leg, or if there is an imbalance, then there is a gait training and part for the stroke. Have multiple comorbidities like kidney patients, they have the heart problem, so single blood thinner will do, or the double blood thinner will do. So it is not the self-medication. You have to go on. I tell you, as you age, most of the patient, they have a heart rhythm problem and they suffer stroke. We call it as a atrial fibrillation, and it is one of the most common cause of having a stroke. That is the non-atrial fibrillation. So we do definitely do the echo of the heart, but even we advise for know the mechanism of stroke. We do the whole identify their rhythm of the heart is okay or not. Many people, they are so knowledgeable, they come with information. Do the echo of the heart, know the pumping of the heart. But sometimes there is the rhythm of the heart is also very important. Now, to clear about few datas, if you think that how the stroke is placed across the world, it is the third leading cause of death. And if you see this hour, more than 100 patients are dying of stroke across the world. And in India, if you see that every 45 seconds, some is suffering a stroke. So there is one question came up on, and I'm very glad there is a question came up. What are the sleeping? Very good question. See, when you are sleeping, most of the stroke you have seen they occur in the winter, from the season of September to March, as summer has gone to October. So October to Feb or March, they suffer a stroke, because when morning, your sympathetic activity is very high and your blood pressure is very variable. So when you go to sleep, you don't have a chances. I have seen many patients coming to the hospital early morning at 6:30, 6 o'clock to the hospital with the one side paralysis or the speech. So we don't have the time onset. We call them wake up stroke, because we ask the relative what was the time of onset. They say we take the last seen well time of those patients to treat such patient. So sleeping, we increase the sympathetic activity. And I think I have another question. What are the basic signs of stroke? The symptom. Now we'll talk about the sign. For that, I will show you, this is one of the things which we propagate very much, is Harsha Vogle, right? Most of the Indians, they may be identifying him. He's a stroke ambassador for, there is a FAST, F-A-S-T, and we call it act fast. F is face, there is a deviation of the face and there is slurred speech. Then second is the arm. There is a dropping of the arm, that is S is speech, there will be slurred speech. And T is the time, that is time is brain. If time is lost, brain is lost. So whenever you have these symptoms, you should act fast and go straight to the hospital. You should straight run to the hospital treatment. And I'm loving it that more and more questions are coming. I would love to answer them. Which age group is prone to stroke? Human, whatever age it is, they are prone to stroke. There are more risk factors. So we have treated a patient as young as 18. We have treated, which we come in adult, those who are smokers for 4-5 years. We have treated patients who are in their 20s and 30s. We have, as you age, you have multiple risk factors. We have treated stroke. So age is no bar and sex is no bar, gender is no bar for acute stroke. So anybody can suffer acute stroke. Another question. What are the chances of not getting affected after a stroke? Very right. If you reach in time and you get yourself treated, there are fair chances that after 3 months we do a MRS, that is known as Modified Ranking Scale, disability score. And if you reach in golden window, and if you get treated, you come in 0 to 2, means you are independent in doing your activity. And that is, whenever we treat a stroke, we want to make our stroke patient independent. So there are many who are during their working age, so they can work, they are independent in daily activities of the household activities, what we're doing. That is our aim after 3 months. So blockbuster drug, we are not giving a magic bullet. So we see our patient after 3 months, how much independent they are, even if they reach in the golden window. Even if they don't reach, our aim is to make them independent by physiotherapy or by treating their risk factors to independently work again. He had a very good painting after suffering a stroke, and his hand was not working, and he was to use his hand again and to paint again, because he cannot live without it. A professor who's teaching in the school or college, if he has a slight slur of speech, his profession is gone, his bread, his passion, his daily living is gone. So even they have a slurred speech, we treat this patient very aggressively because that is their profession. Like those who are playing guitar, therefore the hand movements is very important. So another question for us, and are there any warning sign or symptoms before a stroke? What are they? Always remember that whatever disease it is, if it is heart or brain, there are warning signs. So we neglect them. So whenever there is a mild, we have one word, what we put in stroke is transient ischemic attack. Many patients go with their mild symptoms like weakness in the hand and leg and the facial deviation. In 5 minutes, they are totally all right. They go to the doctor and the doctor says to them, oh, you are very lucky that you recovered in 5 minutes. But that is a warning sign. You should go to a neurologist, you should go to a stroke neurologist and get yourself checked. And we call ourselves as a plumber. We see their arteries by doing a simple carotid Doppler test. We have a machine at our place that is known as transcranial Doppler, that is the sonography of the brain. And we do that and identify where the clot is, right? We do the echo. These are the normal tests. If you do, you identify, and so we don't call a transient ischemic attack, we call take immediate action to treat. There is another question with us, and it's a question from one of the audience that my aunt had stroke 6 months back and has not completely recovered. She still limps while walking. Is it not possible to recover completely from post-stroke? Because what we want to state, clear the myth and perception, I will show you that stroke recovery occurs for lifelong. It is not only for 6 months. We have seen patients telling us that they have done physiotherapy and they recover. Every stroke is different. So I will give you some myths and reality about the stroke. And stroke is not preventable. So many strokes are preventable. Then stroke cannot be treated. Then at the last, we have written a neuronal plasticity. Neuronal plasticity is that one part of the brain is affected and you are paralyzed on the other side. That is, the right side is covering the left side. If you have a right side affected, your left hand and leg will become weak. So if you have this affected, that we are God, we have two sides of the brain. The other part of the brain is connected with corpus callosum. That is a bridging. So the other part of the brain take on the damaged part, and that is known as a neuronal plasticity. So we should not stop physiotherapy. We should continue doing it. And after 6 months, there is a slow recovery. Until 2 years, you can get the maximum recovery as you want. The recovery continues, and it can go on lifelong. That is known as neuronal plasticity. Another question from the audience: are there any related medical condition which makes the occurrence of a stroke more likely? As medical condition which, if are not controlled, like blood pressure, diabetes, the kidney disease, if they again the blood pressure, if the lifestyle is not good, that is a syndrome X, right? You are obese, your sugars are not controlled, your lipid is high, so that is known as syndrome, metabolic syndrome. So you should not go into that. Means you keep yourself anorexic, you're not eating. So two extremes we discussed, right? To binge or not to eat, both are bad. So we have to control those risk factors, which are very important. I'm really happy so many questions from the audience are coming, and we are really very happy to answer them. Yeah, this is something which is related to the diet. Is food consumption and lifestyle one of the reason of increase in the stroke these days? Very true, very true. It's a food consumption and lifestyle both, because we give time to work. But how many of us, if we sit back and relax and close our eyes and think that while eating, we are talking, we are discussing our work, we are stressed, I have to go again to the ICU, or some banker has to finish his job today, and he's not eating at peace during his working lunch. Or while going back, they take their worries to home while eating, and they are discussing all those things which has happened today. So while we eat, we don't eat what we don't even see what we are eating. We are not relishing. How much if you have taken your food and tasted, like you see the chef in the master chef, how they are relishing that food, what is there in the food. If somebody asks you, what are you eating? Sometimes you don't even know what I'm eating. It's a rice or a chapati. You don't know about it, right? So these things matter. What you do, you give importance to your work, you give importance to your promotion, you give importance to everything, but you don't give importance to your daily food, what you are eating. It is not the good food, it is the food what you are eating. You're eating by seeing it or not, that is also very important, right? Vegetables, agreed. Fruits, agreed. They are important in diet, and we miss them, right? There is a famous saying, right? Apple a day keeps the doctor away. Like all the fruits, it's not apple. Every fruit except the diabetic, they cannot take banana and the high sugar content food. And the lifestyle, what I was talking about, that at times you are so involved in the work, you forget about your lifestyle, right? You forget about how you have about your morning walks. Even sometimes you walk in the morning, you are with that pedometer or your Fitband. Oh, how much calories? Oh, 9,000 steps done or not done? Oh, 10 count. You're counting numbers. You know, numbers are not important. If you walk freely by seeing in the morning the chirping of birds, that will release your endorphins, right? So you should enjoy that walk. It is on TMT, it is on the treadmill, or wherever you are walking. You should be with the surroundings, not the number. Is my 6,000 steps completed today? Most of them you're listening, you have your Fitbit on, or your steps or your moves on your mobile, right? So no need of keeping that. You just enjoy a walk with your companion or your child, or you go for a walk that will, if it is 2 kilometers or 3 kilometers, it will, but we are not doing it. So lifestyle matters. It is not calculation everywhere important. How much I had done today, right? Sometimes you have to make your mind free. That is also, which is calling as dropping the stress, which is very important. So lifestyle and food will always be part of all the diseases like heart disease or stroke and other diseases. So very good questions coming up from the audience, and I'm really very happy that you are there for this World Stroke Awareness, which Zydus is spreading about stroke, about the brain attack. Now, if we go further about talking about it, we have talked about the symptoms. We have talked about the myths and perception. There are a lot of myths. People take their patient to the places where their stroke treatment is only physiotherapy can be done and nothing else can be done in stroke. They are also scared about the cost. They are very much scared about the cost, that the treatment of stroke will be very high and there will be no results. It is not like this. If you see the results, if you go in that golden period and even you do the angioplasties and other things in different areas, it is a comparable rate to get the treatment, and it is affordable to get, because if you have a stroke and if you don't treat, then that disability for 6 months or 2 years will cost you more than if you go in a golden period and get yourself treated for acute stroke and you are free of paralysis in 3 to 5 days, which is very important. One symptom which we avoid is after age of 40, a sudden onset headache, which is also very important. We avoid our headaches. The headaches had not to be avoided. You have seen, oh, I was not having hypertension, not having diabetes, how the rupture of aneurysm has occurred. Patient is carrying that aneurysm from long. Those are those I call the ruptured arteries. This is the one I was talking about. Those are 50%, I agree. You cannot, no need of seeing my face, but if you see this artery, this is ruptured, right? So this is very important. So whenever you have a sudden thunderclap headache, this is very important that you see a doctor. And don't miss your minor symptoms. Oh, mera haath to, just for the Indian audience, मेरा हाथ तो तकिए के नीचे रह गया था, इसलिए हाथ में सुनपन और कमजोरी है, 2 दिन तक वो हॉस्पिटल नहीं जाएंगे. I have kept my hand below the pillow at the night, so it is not working. It is not like this. Anything happens sudden at the night and morning, you are not able to perform activities, you have to rush to the hospital. So if you see the stroke facts across the world, the lifetime risk of stroke is 1 in 5 in women and 1 in 6 for man. And it is the fact behind 1 in 6, which is the World Stroke Campaign, which is World Stroke Organization is doing. Every 2 seconds, someone in the world is suffering a stroke. Every 6 seconds, someone dies a stroke. Every 6 seconds, someone's quality of life forever will be changed. This line is most important. Every 6 seconds, someone's quality of life. You're not able to use one limb and leg for life is very important. You should understand the chest pain can be relieved by opening the arteries, but the upper limb and lower limb weakness, the hand and leg weakness, if you are not able to do your daily activities, that disability is sometimes very much important. So what happens, you develop a permanent disability if you don't concentrate on even after the post-stroke. 15 million people experience a stroke each year and 6 million of them do not survive. About 30 million people have stroke and they are with the residual disability. Here I will talk about what is post-stroke depression, what is post-stroke epilepsy, what is post-stroke you are not able to do the recreational activities. So post-stroke depression is very important. Out of the blue, you suffer a stroke and you are not able to use a hand or leg or speech, you are not able to speak. Then you go in a phase where you are not taking the treatment, you go in a depression. So that is a vicious circle. Then your energy go very low. So to prevent it, go to a specialist and get yourself treated and get yourself guided. There are so many neurophysiotherapists, there are so many neurorehabilitation centers across the world who are treating stroke, and even in our city, they are treating this stroke. So go to have those services and get yourself free from disability. So I will humbly request all the audience who are listening to this discussion which we are happening between the audience and us, that spot a stroke, act now, and guide the people. If I am able to convey anything today, guide the people to go to the specialist and get the treatment. If you find a stroke, if you find a cardiac arrest, you know how to do the pumping, a cardiac respiration. If you find a person suffering from a stroke, ask them to go to the stroke ready centers. Act fast, act now, spot a stroke, and make a difference in the life of one person. That one life, you will feel so much happy when the person will be without disability. So my humble request to all the audience, act now and remove this disability from the world. Prevent the stroke, and those who have had the stroke, prevent them from the disability. And thank you very much for listening. Thank you.